This is a video on post-streptococcal reactive arthritis. I'm Emily Meyer. Let's talk a bit about the how, what, and why. PSRA develops during or after an infection with group A strep. It is not a result of the bacteria, but it is a result of the inflammatory process that occurs in the body in response to the strep. So how do we know that it's PSRA? The onset is 7 to 10 days after a strep infection, and it usually responds poor to moderate to NSAID treatment, which would be like ibuprofen or naproxen. So what's happening in the body? There's joint pain and joint swelling. It typically affects the large, small, and axial joints. PSRA most commonly occurs in the joints of the hips and in the joints of the knees. So what can we do about it? We can treat with NSAIDs to help the joint pain, like ibuprofen and naproxen, but as before when we discussed, it responds poorly to moderately to these. We would also want to make sure that we're actively treating the strep infection or make sure that it was previously treated, and that would be with something like amoxicillin or penicillin. So let's review. PSRA is an inflammatory process that occurs after the body has experienced a strep infection. It typically occurs in the joints of the hips, in the knees, and it results in joint pain and joint swelling. We can treat it with NSAIDs, but it may not respond very well to it. We need to make sure that we're treating the strep infection, but it's important to remember that this is self-limiting and will resolve. Thanks for stopping by, and I hope you learned something about PSRA today.